I'm Dr. Neneman with Neneman Chiropractic Clinic, and thanks for joining us again for another week in our video blog series. In today's day and age, everyone wants something now. Life's fast paced. It's go, go, go. And so, we as people, it's kind of natural we want things now. Most people aren't patient. One of those things is pain. When people hurt, they want to feel better now. They don't want to wait to feel better. They want to feel better now. So, a lot of people, they want to do whatever it takes to get them better fast. They don't want to take any time. And so where I'm going with this is a lot of people jump into spinal surgery. I always preach to patients, try the most conservative approach first. Don't jump to the most invasive thing there is. Most patients, they hurt, they want relief now, so usually they're going to try pain meds first. But if they're not getting good results with that, they're going to probably have an orthopedic consultation, and that orthopedic doctor is going to say you need surgery. One thing I always say, and it's not a knock on them, but what does an orthopedic surgeon do? They do surgery. The same goes for chiropractors. What do? We adjust the spine. That's what we do. So if you consult with the orthopedic surgeon, if there is some sort of a problem, how do they solve it? They solve it with surgery. So that's a lot of times what is going to be recommended to the person. And a lot of people think, okay, I'll get it operated on, boom, the problem will be gone. And so what I want to talk about today is spinal surgery, and does it really get good results? Is it really going to be beneficial for you? Is it really going to get you better fast like you want it to? And like I always say, this is not a knock on surgery. I just want to emphasize that when it comes to spinal surgery, the results aren't always positive. So I just want to emphasize to everyone that you should try the most conservative approach first. And what I'm going to do is I'll talk about, there's numerous different types of spinal surgery out there, but I'm going to talk about the two most common that you see, because that's just typically these are the surgeries that you'll see. One is a discectomy, that's where they actually go in. There's a bulging disc, and that disc, when it bulges out, a lot of times it'll hit a nerve, causing lots of pain, could cause numbness and tingling down an arm or a leg. And so what that surgery aims to do is a surgeon will go in where that disc is bulging, and they'll actually snip it away. That bulging part, that's probably hitting the nerve, they cut it away. And one thing with the discectomy is it's a little less invasive. It's not as invasive as a fusion surgery, which I'll talk about in a minute. But the thing with that is, it may get good results. If they cut that disc away, it's not touching the nerve anymore. Maybe the patient feels better. But a lot of times the patient still won't get great results, or they may feel better for a while, but then after that they start hurting really bad again. And this is why. A lot of times when that disc is bulging, there's associated degeneration with it, meaning there's bone spurring, there's decreased joint space, there's calcium buildup in the area. So even though that surgeon may cut away that part of the bulging disc, there's still less space due to calcium buildup, bone spur buildup. So even though that bulging disc is cut away, not the entire disc, but just the bulge part, that patient's still going to get tingling or numbness or pain because, again, that nerve still doesn't have a lot of space in there due to the bone spurring or the degeneration. So a lot of times when a person gets a discectomy, they either don't get any pain relief, or they do temporarily, but then after so many months, again, that degeneration really starts irritating that nerve. The second type of surgery I want to talk about, which is very common, is an actual spinal fusion. And what the surgeon aims to do, you have an area that's degenerated, maybe the disc is bulging or herniated. So what the surgeon does is they actually go in, they remove the disc. They usually put in some sort of filler or spacer where that disc used to be. They try to maintain adequate space to take pressure off the nerve, but then they actually put in hardware to fuse that area together. So the vertebra, the filler or spacer where the disc used to be, and then the vertebra below, that whole area becomes fused. They put in screws and plates, and then over time, besides having the screws and plates in there, there'll be bone calcium buildup that'll help fuse the rest of the area. And so what that does is it prevents a disc from pushing on the nerve, prevents the vertebra from being able to approximate and become closer. It attempts just to stabilize the area so nothing else can move around and hit the nerve or the spinal cord. But again, here's where there's a problem. What people don't think about is when you have an area of the spine being fused, you're actually losing, you have zero range of motion in that particular area. The spine, you have 24 movable vertebrae for a reason, so you can, have full range of motion, be able to turn, twist, move. And so when that area becomes fused, you have no range of motion at that area. So what happens is the areas above or below that fused area have to overcompensate. If your L4 and L5 are fused, that tailbone below and that L3 vertebra above, they have to do all the work, for you to bend it forward and tie your shoe. That area above and below the fusion have to do all the work in order for you to get forward flexion or to get rotation. And so what ends up happening is those areas that are overworking or overcompensating, they start to degenerate. Bone spurring, decreased disc space, the disc might start to bulge, hit the nerve. So what I see a lot of times with patients that have had one fusion surgery is they go back and have to get more. Next thing, they're fusing the vertebra above, and I've seen it where people have 2, 3, 4 surgeries where they just keep fusing more and more vertebra to where again they're going to have almost a completely fused spine. And so again, I talk about this today to further educate you on these surgeries. And by no means I'm not a surgeon. I don't know as much about these surgeries as a surgeon does, but I'm just basically talking about the basics of what goes on. There's numbers out there. There's probably different studies, but I've heard things like only 30% of spinal surgeries are successful. So that means 70% of patients, the pain comes back or they don't feel any relief. So by no means am I harping on surgery. I'm just letting you know they're not always successful. Try the most conservative approach first. The conservative approach being chiropractic. I always tell people, let's try chiropractic. If it doesn't work, if you don't get any better, I usually recommend another conservative approach, whether it be, massage, acupuncture, physical therapy. There's other things out there. I say use surgery as a last resort. I have had patients where they've tried they've tried acupuncture, massage, physical therapy. They're coming to me. We try chiropractic. They don't get a lot better. If they've tried everything there is, and usually before surgery, there's epidural injections, which is less invasive but more invasive than chiropractic. Try all those things. If it doesn't work, yes, then there is surgery. So, by no means am I saying it's bad or evil. Just saying wait, try all the other things first that are less invasive. And if you get to that point where, nothing's working, then you can go get a consultation for a surgery. But again, I really hope this helps you understand the type of spinal surgeries a little better. And hopefully it'll help steer you in the right direction. If you're getting horrible pain and you go talk to a doctor, he says, let's get surgery, please try chiropractic first. Because again, a lot of times surgeries are not successful. They may be, but a lot of times they're not. So think twice before you want to just dive into surgery. Be patient. Give a chiropractic series of treatments a chance. Join us again next week. We'll have another good discussion or topic to go over. Have a great weekend. Thanks.